Infertility. Infertility means not being able to get pregnant after 1 year of trying, or 6 months if a woman is 35 or older. Women who can get pregnant but are unable to stay pregnant may also be infertile. About 10% of women, 6.1 million, in the United States ages 15 to 44 have difficulty getting pregnant or staying pregnant, according to CDC. For heterosexual couples, 1/3 of causes of infertility are due to a male problem, 1/3 are due to a female problems, and 1/3 are due to combination or unknown reasons. When the cause of the infertility is found to come from the female partner, it's considered female infertility or female factor infertility. Infertility is a common disease. At least 10% of women deal with infertility of some kind. The chances of being infertile increases as a woman ages. Pregnancy is the result of a process that has many steps. To get pregnant, a woman's body must release an egg from one of her ovaries, ovulation. The egg must go through a fallopian tube toward the uterus, womb. A man's sperm must join with, fertilize, the egg along the way. The fertilized egg must attach to the inside of the uterus, implantation. Infertility can happen if there are problems with any of these steps. Causes of female infertility. Locations of female reproductive organs. Female reproductive system. Egg being fertilized and implanting in the uterus. Fertilization and implantation. For pregnancy to occur, every step of the human reproduction process has to happen correctly. The steps in this process are: one of the two ovaries releases a mature egg. The egg is picked up by the fallopian tube. Sperm swim up the cervix, through the uterus and into the fallopian tube to reach the egg for fertilization. The fertilized egg travels down the fallopian tube to the uterus. The fertilized egg attaches, implants, to the inside of the uterus and grows. In women, a number of factors can disrupt this process at any step. Female infertility is caused by one or more of the factors below. 1. Ovulation disorders. Ovulating infrequently or not at all accounts for most cases of infertility. Problems with the regulation of reproductive hormones by the hypothalamus or the pituitary gland or problems in the ovary can cause ovulation disorders. 2. Polycystic ovary syndrome, PCOS. PCOS causes a hormone imbalance, which affects ovulation. PCOS is associated with insulin resistance and obesity, abnormal hair growth on the face or body, and acne. It's the most common cause of female infertility. 3. Hypothalamic dysfunction. Two hormones produced by the pituitary gland are responsible for stimulating ovulation each month. Follicle-stimulating hormone, FSH, and luteinizing hormone, LH. Excess physical or emotional stress, a very high or very low body weight, or a recent substantial weight gain or loss, can disrupt production of these hormones and affect ovulation. Irregular or absent periods are the most common signs. 4. Primary ovarian insufficiency. Also called premature ovarian failure, this is usually caused by an autoimmune response or by premature loss of eggs from your ovary, possibly as a result of genetics or chemotherapy. The ovary no longer produces eggs, and it lowers estrogen production in women under age 40. 5. Too much prolactin. The pituitary gland can cause excess production of prolactin, hyperprolactinemia, which reduces estrogen production and can cause infertility. This can also be caused by medications you're taking for another condition. 6. Damage to fallopian tubes, tubal infertility. Damaged or blocked fallopian tubes keep sperm from getting to the egg or block the passage of the fertilized egg into the uterus. Causes of fallopian tube damage or blockage can include pelvic inflammatory disease, an infection of the uterus and fallopian tubes due to chlamydia, gonorrhea or other sexually transmitted infections, previous surgery in the abdomen or pelvis, including surgery for ectopic pregnancy, in which a fertilized egg implants and develops somewhere other than the uterus, usually in a fallopian tube. 7. Endometriosis. Endometriosis occurs when tissue that typically grows in the uterus implants and grows in other places. This extra tissue growth, and the surgical removal of it, can cause scarring, which can block fallopian tubes and keep an egg and sperm from uniting. Endometriosis can also disrupt implantation of the fertilized egg. The condition also seems to affect fertility in less direct ways, such as damage to the sperm or egg. 8. Uterine or cervical causes. Several uterine or cervical causes can interfere with the egg implanting or increase the risk of miscarriage. Tumors. Benign polyps or tumors, fibroids or myomas, are common in the uterus. Some can block fallopian tubes or interfere with implantation, affecting fertility. However, many women who have fibroids or polyps do become pregnant. Problems with the uterus present from birth, such as an unusually shaped uterus, can cause problems becoming or remaining pregnant. Cervical stenosis, a narrowing of the cervix, can be caused by an inherited malformation or damage to the cervix. Sometimes the cervix can't produce the best type of mucus to allow the sperm to travel through the cervix into the uterus. 9. Unexplained infertility. In some cases, the cause of infertility is never found. A combination of several minor factors in both partners could cause unexplained fertility problems. Although it's frustrating to get no specific answer, this problem can correct itself with time. But you shouldn't delay treatment for infertility. Who is at risk for female infertility? Many factors can increase a woman's risk of female infertility. General health conditions, genetic, inherited, traits, lifestyle choices and age can all contribute to female infertility. Specific factors can include 1. Age. 2. Hormone issue that prevents ovulation. 3. Abnormal menstrual cycle. 4. Obesity. 5. Being underweight. 6. Having a low body fat content from extreme exercise. 7. Endometriosis. 8. Structural problems, problems with the fallopian tubes, uterus or ovaries. 9. Uterine fibroids. 10. Cysts. 11. Tumors. 12. Autoimmune disorders, lupus, rheumatoid arthritis, Hashimoto's disease, thyroid gland conditions. 13. Sexually transmitted infections, STIs. 14. Polycystic ovary syndrome, PCOS. 15. Primary ovary insufficiency, POI. 16. Excessive substance use, heavy drinking. 17. Smoking. 18. Day syndrome. Day is a medication that was given to women to prevent complications in pregnancy like premature birth or miscarriage. However, this medication has caused infertility in some of the children of mothers who took day. 19. A past ectopic, tubal, pregnancy. Age. How does age impact female infertility? As a woman ages, her chances of becoming pregnant decreases. Age is becoming a more common factor in female infertility because many couples are waiting to have children until their 30s or 40s. Women over age 35 have a higher risk of having fertility issues. The reasons for this include: overall number of eggs is lower. More eggs have an abnormal number of chromosomes. An increased risk of other health conditions. General risk factors for female infertility. Certain lifestyle factors may put you at higher risk of infertility, including age. The quality and quantity of the woman's eggs begin to decline with age. In the mid-30s, the rate of follicle loss speeds, resulting in fewer and poorer quality eggs. This makes conception more difficult, and increases the risk of miscarriage. Smoking. Besides damaging your cervix and fallopian tubes, smoking increases your risk of miscarriage and ectopic pregnancy. It's also thought to age your ovaries and deplete your eggs prematurely. Stop smoking before beginning fertility treatment. Weight. Being overweight or significantly underweight may affect ovulation. Getting to a healthy body mass index, BMI, might increase the frequency of ovulation and likelihood of pregnancy. Sexual history. Sexually transmitted infections such as chlamydia and gonorrhea can damage the fallopian tubes. Having unprotected sex with multiple partners increases your risk of a sexually transmitted infection that may cause fertility problems later. Alcohol. Excess alcohol consumption can reduce fertility. Prevention of female infertility. For women thinking about getting pregnant soon or in the future, these tips might help. Maintain a healthy weight. Overweight and underweight women are at increased risk of ovulation disorders. If you need to lose weight, exercise moderately. Strenuous, intense exercise of more than 5 hours a week has been associated with decreased ovulation. Quit smoking. Tobacco has multiple negative effects on fertility, as well as your general health and the health of a fetus. If you smoke and are considering pregnancy, quit now. Avoid alcohol. Heavy alcohol use may lead to decreased fertility. And any alcohol use can affect the health of a developing fetus. If you're planning to become pregnant, avoid alcohol, and don't drink alcohol while pregnant. Reduce stress. Some studies have shown that stress can cause couples to have poorer results with infertility treatment. Try to reduce stress in your life before trying to become pregnant. What tests will my healthcare provider run to diagnose female infertility? Some tests may be done in your healthcare provider's office as a physical exam. These tests may include an overall physical exam, a pelvic exam, a pelvic ultrasound, an examination of the breasts for unusual milk production. Other tests may need to be done in a lab. These tests can include blood tests. The type of lab tests will depend on your health history and what diagnosis your doctor is considering. Examples of lab tests include thyroid testing, prolactin levels, tests of ovarian reserve and progesterone, a hormone produced during the menstrual cycle that signals ovulation. X-ray hysterosalpingogram, HSG. A dye is injected into the cervix and the caregiver watches how the dye moves through the fallopian tube with an X-ray. This test checks for blockages. Laparoscopy. In this test, a small monitoring instrument called a laparoscope is inserted into the abdomen to look at the organs. Transvaginal ultrasound. Unlike an abdominal ultrasound, where the probe is placed over the belly, this test is done by inserting an ultrasound wand into the vagina. It allows the healthcare provider a better view of organs like the uterus and ovaries. Saline sinohysterogram, SIS. This test is used to look at the lining of the uterus and assess for polyps, fibroids or other structural abnormalities. Saline, water, is used to fill the uterus, allowing the healthcare provider to get a better view of the uterine cavity during a transvaginal ultrasound. Hysteroscopy. In this test, a device called a hysteroscope, a flexible, thin device with a camera on it, is inserted into the vagina and through the cervix. The healthcare provider moves it into the uterus to view the inside of the organ. How is female infertility treated? Laparoscopy. If you've been diagnosed with tubal or pelvic disease, one option is to get surgery to repair your reproductive organs. Your doctor puts a laparoscope through a cut near your belly button to get rid of scar tissue. Treat endometriosis, open blocked tubes, or remove ovarian cysts, which are fluid-filled sacs that can form in the ovaries. Hysteroscopy. In this procedure, your doctor places a hysteroscope into your uterus through your cervix. It's used to remove polyps and fibroid tumors, divide scar tissue, and open up blocked tubes. Medication. If you have ovulation problems, you may be prescribed drugs such as clomiphene citrate, Clomid, Seraphine. Gonadotropins, such as Gonal-F, Follistim, Humagon and Pregnil, or Letrozole. Gonadotropins can trigger ovulation when Clomid or Seraphine don't work. These drugs can also help you get pregnant by causing your ovaries to release multiple eggs. Normally, only one egg is released each month. Your doctor may suggest that you take gonadotropin if you have unexplained infertility or when other kinds of treatment haven't helped you get pregnant. Metformin, glucophage, is another type of medication that may help you ovulate normally if you have insulin resistance or PCOS, polycystic ovarian syndrome. Intrauterine insemination. For this procedure, after sperm gets rinsed with a special solution, a doctor places it into your uterus when you're ovulating. It's sometimes done while you're taking meds that help trigger the release of an egg. In vitro fertilization, IVF, In this technique, your doctor places embryos into your uterus that were fertilized in a dish. You take gonadotropins that trigger the development of more than one egg. When the eggs are mature, your doctor uses an ultrasound for guidance and collects them with a needle. Sperm are then collected, washed, and added to the eggs in the dish. Several days later, embryos or fertilized eggs get put back into your uterus with a device called an intrauterine insemination catheter. If you and your partner agree, extra embryos can be frozen and saved to use later. ICSI, intracytoplasmic sperm injection. A doctor injects sperm directly into the egg in a dish and then places it into your uterus. Zygote intrafallopian transfer, ZIFT, or tubal embryo transfer and gamete intrafallopian transfer, GIFT, are other ART methods that are rarely used in the United States today. With ZIFT, fertilization occurs in the laboratory similar to IVF. Then the very young embryo is transferred to the fallopian tube instead of the uterus. GIFT involves transferring eggs and sperm into the woman's fallopian tube, and fertilization occurs in the woman's body. ART procedures sometimes involve the use of donor eggs from another woman, donor sperm, or donated embryos. Donor eggs are sometimes used for women who cannot produce eggs. Also, donor eggs or donor sperm are sometimes used when the woman or man has a genetic disease that can be passed on to the baby. An infertile woman or couple may also use donor embryos. These are embryos that were either created by couples in infertility treatment or were created from donor sperm and donor eggs. The donated embryo is transferred to the uterus. The child will not be genetically related to either parent. Donor eggs, sperm, or embryos may also be used by same-sex couples. Gestational carrier. Women with ovaries but no uterus may be able to use a gestational carrier. This may also be an option for women who shouldn't become pregnant because of a serious health problem. In this case, a woman uses her own egg and it is fertilized by her partner's sperm. Then, the embryo is placed inside the carrier's uterus. Pre-implantation genetic testing is a procedure used to identify genetic disorders or chromosomal abnormalities in embryos created during an IVF cycle. One or more cells are biopsied from each embryo and sent for testing. These procedures used to be referred to as pre-implantation genetic screening and pre-implantation genetic diagnosis. Some common medicines used to treat infertility in women include clomiphene citrate, Clomid, is a medicine that causes ovulation by acting on the pituitary gland. It is often used in women who have polycystic ovary syndrome, PCOS, external icon or other problems with ovulation. It is also used in women with normal ovulation to increase the number of mature eggs produced. This medicine is taken by mouth. Letrozole, Femara, is a medication that is frequently used off-label to cause ovulation. It works by temporarily lowering a woman's progesterone level, which causes the brain to naturally make more follicle-stimulating hormone, FSH. It is often used to induce ovulation in women with PCOS, and in women with normal ovulation to increase the number of mature eggs produced in the ovaries. It is taken by mouth. Human menopausal gonadotropin or HMG, Menopur. Repronex, Berganol, is an injectable medication often used for women who don't ovulate because of problems with their pituitary gland. HMG acts directly on the ovaries to stimulate development of mature eggs. Follicle-stimulating hormone or FSH, Gonal-F, Follistim, is an injectable medication that works much like HMG. It stimulates development of mature eggs within the ovaries. Gonadotropin-releasing hormone, GnRH, analogs and GnRH antagonists are medications that act on the pituitary gland to prevent a woman from ovulating. They are used during in vitro fertilization cycles, or to help prepare a woman's uterus for an embryo transfer. These medications are usually injected or given with a nasal spray. Metformin, glucophage, is a medicine doctors use for women who have insulin resistance or diabetes and PCOS external icon. This drug helps lower the high levels of male hormones in women with these conditions. This helps the body to ovulate. Sometimes clomiphene citrate or FSH is combined with metformin. This medicine is taken by mouth. Bromocriptine, Parladel, and cabergoline, Dustinex, are Medications used for women with ovulation problems because of high levels of prolactin. These medications are taken by mouth. Multiples. Many fertility drugs increase a woman's chance of having twins, triplets, or other multiples. Women who were pregnant with multiple fetuses may have more problems during pregnancy. Multiple fetuses have a higher risk of being born prematurely, too early. Premature babies are at a higher risk of health and developmental problems. Risks of fertility drugs. Using fertility drugs carries some risks, such as pregnancy with multiples. Oral medications carry a fairly low risk of multiples, less than 10%, and mostly a risk of twins. Your chances increase up to 30% with injectable medications. Injectable fertility medications also carry the major risk of triplets or more. Generally, the more fetuses you're carrying, the greater the risk of premature labor, low birth weight and later developmental problems. Sometimes, if too many follicles develop, adjusting medications can lower the risk of multiples. Ovarian hyperstimulation syndrome, OHSS. Injecting fertility drugs to induce ovulation can cause OHSS, which is rare. Signs and symptoms, which include swollen and painful ovaries, usually go away without treatment, and include mild abdominal pain, bloating, nausea, vomiting and diarrhea. It's possible to develop a more severe form of OHSS that can also cause rapid weight gain, enlarged painful ovaries, fluid in the abdomen and shortness of breath. Long-term risks of ovarian tumors. Most studies of women using fertility drugs suggest that there are few if any long-term risks. However, a few studies suggest that women taking fertility drugs for 12 or more months without a successful pregnancy might be at increased risk of borderline ovarian tumors later in life. Women who never have pregnancies have an increased risk of ovarian tumors, so it might be related to the underlying problem rather than a treatment. Since success rates are typically higher in the first few treatment cycles, re-evaluating medication use every few months and concentrating on the treatments that have the most success appear to be appropriate. Surgery to restore fertility. Several surgical procedures can correct problems or otherwise improve female fertility. However, surgical treatments for fertility are rare these days due to the success of other treatments. They include surgery, laparoscopic or hysteroscopic surgery. Surgery might involve correcting problems with the uterine anatomy, removing endometrial polyps and some types of fibroids that misshape the uterine cavity, or removing pelvic or uterine adhesions. Tubal surgeries. If your fallopian tubes are blocked or filled with fluid, your doctor might recommend laparoscopic surgery. To remove adhesions, dilate a tube or create a new tubal opening. This surgery is rare, as pregnancy rates are usually better with in vitro fertilization, IVF. For this surgery, removal of your tubes or blocking the tubes close to the uterus can improve your chances of pregnancy with IVF. ART success rates vary and depend on many factors, including the clinic performing the procedure, the infertility diagnosis, and the age of the woman undergoing the procedure. This last factor, the woman's age, is especially important. ART can be expensive and time-consuming, but it has allowed many couples to have children that otherwise would not have been conceived. The most common complication of ART is a multiple pregnancy. This is a problem that can be prevented or minimized by limiting the number of embryos that are transferred back to the uterus. For example, transfer of a single embryo, rather than multiple embryos, greatly reduces the chances of a multiple pregnancy and its risks such as preterm birth.